Go.
All right, so our group is doing Wernicke's Aphasia, and my name is Vivian Stein.
I'm Yesenia Garcia.
I'm Lita Brown.
And I'm Loredana Nar. Wernicke's aphasia, also known as receptive aphasia, is a disorder characterized by impaired communication and language comprehension. Speech may have normal rate, rhythm, and grammar, and patients may not recognize errors in their speech due to impaired comprehension.
So I split up the symptoms into two categories, speech and comprehension symptoms, which are the main symptoms, and then we have the brain function symptoms. Starting off with the speech and comprehension symptoms, the most common one is their inability to make sentences that make sense. So basically, their sentences don't make sense because they're constantly making up words with no meanings, and they also just add random words into their sentences when they're speaking. Because they have no control really of what they're saying, they often speak really quickly, or they also are constantly interrupting. If you ever ask someone with this disorder to repeat something, they would have a difficult time doing this because, like I said, they have no control over what they're saying. And in terms of brain function symptoms, they have impaired reading and writing abilities. So because of this, they have to develop new learning styles. So they often become visual learners. And I included this picture just because it's some of the most common symptoms.
So after a person is diagnosed with Wernicke's aphasia, their quality of life is affected in many different ways. In a population-based study, Lamb and Wadchees found that aphasia exhibited the largest negative influence on quality of life, followed by cancer and Alzheimer's disease. And I think that this is largely due to the fact that normally when someone is diagnosed with this condition, they have been used to being able to communicate effectively throughout a large part of their lives. And then when diagnosed with this condition, they are looked at differently and they're not sure why. And it just makes it so much harder to communicate very simple things. So this condition affects how they interact with in social activities, in their work life, especially if they work with phones and they have to speak on phones all the time. That's gonna take a big toll on their work life and also affects the way that they view themselves. This can lead to people not inviting them to different things and leaving them out of social gatherings. And all of these things combined can lead to depression.
The most common cause is an ischemic stroke, but some other causes are brain trauma, cerebral tumors, central nervous system infections, and degenerative brain disorders. Approximately 170,000 new cases of aphasia per year are stroke-related. The most common cause in most patients is an embolic stroke, which affects the inferior division of the middle cerebral artery, which supplies the temporal cortex. While speech rate and annotation is normal, the content is often difficult to understand due to paraphasic errors. Semantic paraphasia is where a word is substituted for another, for example, saying watch instead of clock. And phonemic paraphasia is where a sound or syllable is substituted for another, saying dock instead of clock. Severe cases may result in neologism, new words or word salad, and may make communication unintelligible. This is why patients find words such as stuff or thing easier to substitute for words that they might actually say. And associated neurological symptoms include visual field deficits, trouble with calculation, and writing. Reading is also often impaired. And in general, patients with Wernicke's aphasia, they're not aware of their deficits, but sometimes they may become aware of their errors in language if it's presented to them in an audio format.
All right, so a lot of people would probably wonder how it's diagnosed because this disorder is recognized through the Wernicke's area. There are a few scans that a doctor would look at first. And to start out, they would look at an MRI and a CT. The Wernicke's area is mainly used for language and comprehension. So doctors then test the ability to see if that part of the brain is damaged, mainly by seeing if they can speak correctly, express ideas, and reading and writing. And some of the pictures that I have are on the top one is the difference between a normal brain and one with the disorder. And then at the bottom, it's kind of an example of how their sentences can be confused and kind of mixed up. And as you can see, basically to know how it's diagnosed, you basically have to know if you either have a really bad concussion or if you have a head injury.
So in terms of treatment options, there isn't many, but the most common one would be speech and language therapy. Speech and language therapy is the main type of treatment that patients with this disorder have. Speech therapy works to improve communication using remaining language abilities, and it also works to learn new ways of communication. Throughout the therapy, they do exercises to keep the remainder of their abilities intact. And in addition, it's harder to keep track of improvement for chronic cases of this disorder. Individual therapy is used to target specific needs an individual may have. And similar to other types of therapies, they also have support groups, which are usually smaller in size. These are more beneficial because it increases their communication skills in small group settings. I listed a list of activities that people with this disorder should be involved in, such as the book club, drama and art club, and technology groups. These activities help improve/increase self-esteem, confidence, and overall communication skills.
So, Wernicke's aphasia can also affect a person's home life. It can definitely take a toll on personal relationships and marriages included. So, in the video linked, this lady describes what it's like living with her husband who has been diagnosed with this condition. And she explains how she's had to do a lot of research and how it's been a huge learning experience. And it's also super important for spouses to find a support group or even just someone who they can lean on and understands their specific situation without judgment. It really helps them not feel alone. And she also speaks about how important it is to take care of yourself during this time. Being engulfed in the situation 24/7 can be super strenuous on their relationship. So she says how she'll go out with her son for a day or even just take a half a day to be around her friends and just people who can communicate more effectively.
So there are a few ways you can help if you know someone with this disorder. The first one would be to attend therapy sessions. This is obviously if the patient feels okay with it or if they want you to. Using short and uncomplicated sentence is also effective because they have trouble understanding what you're saying. If you're ever like in a group setting, it's also important to be inclusive with them and to make sure they don't feel secluded at any times. When having conversations with them, just minimizing overall distractions is better because if there's like a loud TV, loud music, or something, it makes it harder for them to understand what you're saying. And avoid correcting the individual because it can often feel degrading, especially because they have no control over what they're saying. It can be really hurtful if you're constantly correcting them. And most importantly, just be patient with them because it's going to be hard for both ends of it.
All right, so recovery is something that differentiates between kind of how bad the severity of the injury is. So according to a journal on Aphasiology written in 2002, the recovery can differ between people, and some can improve after 2 days and some can be years. Some of these hypotheses to why it can happen so fast is because there's more blood flow towards the brain, or they have rapid organization, which means the neurons in your brain basically kind of make up for the damage that was lost. And after treatments in speech therapy, recovery moves really fast, but it all depends on the severity of the injury again. But in this video, there's a patient that has recovered and is still dealing with fluent aphasia, and it's pretty cool to look at.
Hi, Byron. How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talked with the people for them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment, they don't show a darn thing.
With the iPad that we were doing. We like here?
I'd like my change for me and change hands for me. It would happen. I would talk with Donna sometimes. We're out with them. Other people are working with them. I'm very happy with them.
Good.
This girl was very good and happy. And I play golf and hit up trees. We play out with the hands. We save a lot of hands on hold for us, other hands. I don't know what you get, but I talk with a lot of hands for him. Sometime. Am I talk of any more to say?
All right. Thank you very much.
Thank you very much. I appreciate it. And I hope the world lasts for you.
Thank you. It's been a pleasure. Bye-bye.
Have a good day.